insight on the story. We now welcome Steve Walz, the international media spokesperson from Sheba Medical Center here in Israel. Steve, thank you so much for your time. Now, the rollout in Israel has been the fastest per capita worldwide, and now, though, it seems there may be a need to have a break for a week or two. Is this just a short bump in the road, so to speak? What do you make of the process so far?
First of all, it's been miraculous what we've been able to do so far. I mean, at our hospital, we were the first in Israel to launch the rapid vaccination program 2 weeks ago, almost 3 weeks ago on Saturday night, when you saw the Prime Minister get vaccinated, followed by our CEO and the senior staff. We have vaccinated so far just at Sheba Hospital about 45,000 people, including staff. Yes, we're going to go into, the hospitals are going to go into a timeout process for the next week or two. But again, as Emily had mentioned, we do have enough vials of the Pfizer vaccine on hand to start vaccinating both staff and those who have been vaccinated the first time with the Pfizer vaccine beginning Sunday morning.
And Steve, Sheba Hospital also saying 50% of people vaccinated have developed antibodies. What is the significance of this? Does this mean that medical professionals might rather focus on those who haven't had the first shots yet? Break it down for us.
Well, first of all, this goes in line with the original Pfizer research where people who develop antibodies, it's everybody's body is different. So we have found in the first 100 people that after 2 weeks, they have developed antibodies. But we're going to examine more and more people. And those who don't have antibodies in the first vaccine will definitely have them, without a doubt, after the second dose within a week or two after getting that second dose. And that fits exactly with Pfizer's research. And we're going to be researching all the way through. Again, the big question is how long will these antibodies last in the system? So from what I'm being told by the head of our infectious disease and research department is that this will be a 1-year research of the people who are receiving the vaccines.
And you talk about the latest developments. Are you surprised that the number of cases in the country has spiked to more than 8,000 in the past day, despite the current measures and, of course, this vaccination rollout? What are your thoughts about these numbers?
These are scary numbers, and I'm beginning to feel at Sheba like we're going through the first horrific wave that we went through. A mistake was made along the way. I think everybody in the hospital system had warned the government weeks ago that if they didn't, use stricter measures, that we would get to this. And, between a combination of keeping everything open over the Hanukkah holiday and also people flying to various places around the world, especially in the Gulf, this was inevitable. We knew it was going to happen, but we are really in a dangerous situation here. The hospitals, all hospitals are reaching a maximum capacity to handle corona cases. And understand where the media has not focused on the fact that we've been very lucky. Remember, we are in flu season. If, God forbid, the flu season hit us hard now on top of corona, the system would collapse.
And given what you're saying, Steve, what advice would you give to each citizen watching as the country expects to face stricter lockdown measures soon? Briefly, what advice would you be sharing right now for individuals watching?
The same thing that I've been saying all along for a long time. People, even if you get the vaccination, that doesn't mean you are 100% cured or able to get the virus. You can still get the virus.
Right.
People need to understand that the war is not over. We are at the beginning, at the first part of the end of the war. Right. People need to wear their masks. People need to distance themselves. People need to follow the rules. And if they don't, we're going to be in lockdowns over and over and over again.
Right. Thank you so much for that advice and your insight as always. Steve Walz from Sheba Medical Center. Thank you for your time.